now we have the next speaker, Dr. Varalakshmi, to present on prevalence of falls, fear of falling, and its association with physical function among older adults, factors associated with falls and implementation of fall prevention strategies. Dr. Varalakshmi, are you there?
So, good afternoon, everyone. So, since morning, we are hearing about the demographic and social transition, how it is resulting into the number of population or the proportion of aging population is increasing. It's just not a global phenomena, and India also is increasingly faster in pace. And we are sooner will be not anymore younger India, we will be silver India. So in connections, when I said that the population aging is a global phenomenon, in the recent India aging report also shows that the projected estimates, what it shows, we are moving much faster than the projected estimates. When the projected estimate says that by 2025 we will be around 8%, we have crossed it much faster than before. And it is estimated by 2050 we will be around 22%. It is not only global number, also India. So having said that, when we said India is increasing much faster, that is 2/3 of global aging population, what the number says, is living in the low and middle income countries. And when we say the number of aging population is increasing, is it just a challenge? Not necessarily. When we say that longevity is in, we are able to see, witness the longevity and our population are living longer, it is also a sign of celebration because it is indicating a national achievement. However, it comes along with challenges. So aging population potentially comes along with several challenges. So these challenges includes not only the functional, but also mental health and also their changing social roles and changing social status in the society and also the cognitive declines. And these are all challenges and to be reality are not independent. They are all interconnected. So among them, one of the major challenge which is less addressed or less identified is what I am going to talk is falls. Falls and fall related injuries are major public health challenge, and because they are connected with the fall related injury as well as disability, and it impairs the quality of life in the later life. So all of us agree that irrespective of our health promoting behaviors, aging is inevitable. So in that case, are we all taking all the measures, that is individual level, family, societal, and also the national, that is policy level? Are we prepared to address the challenges in connection to the aging so that they can live a dignified and graceful aging? They experience a dignified aging in the later part of the life, which is their right also. So falls and fall risk among older adults, when you see 1 in 4 individuals, that is 1/3 of aging adults experience at least one fall each year. And this prevalence of falls in India is almost 14 to 53%. See the major range. When I said 14 to 53%, 53 is a huge number. Falls itself is not a major risk. Fear of falls also is a major drawback for the older adults because it is not only physical debilitation. They also have various reasons why their social participation and their social mobility is restricted. When you see the right side of the graph, the various reasons in one of our recent research indicates, it is from the community-based research, which is indicating that more than 15% of the people, all these reasons are listed out. Among them, you have the several reasons like disinterest to go out because of the body image, because of less recognized, or because of we are not included in the society, various reasons they are perceiving. And fear of falls is one of the major reasons, 36%, because if I fall down, who will take care of me? Because there is no adequate family or social support system in India, especially because of in the midst of changing family dynamics, and our informal care and primary care is almost vanishing. So fear of fall influences their mobility and also their social participation, which also influences are a predisposing factor for depression and also social isolation as well as cognitive declines. So as I said here, cognitive declines, when I said mobility, mobility is not just an independent, it is very strongly connected with the cognition because the executive function of the cognitive parameters use and also the mobility, gait and balance are interconnected. So when we say that the whole brain is involved in the balance, but however, certain brain structures, especially like thalamus and also basal ganglia and our cerebellum are connected with the balance and coordination. And likewise, when we see the number of aging population are increasing 22%, the dementia prevalence also estimated to be 14% by 2050. That means if 22% of our aging population, we are also estimating 14% of them are demented. 14% of overall population. That means more than 50% of them will be demented. So are we ready? Are we ready to take care of them socially and the healthcare system is prepared? So in connection to this, I would like to say why the fall risk prevention is important at the primary level. Because it is required not only from the system, but also individual level preparedness, the environment, family, that is home, and having a regular activity, and also addressing the vision, cognition, depression related challenges. So it is a holistic. So we have to address not a single component, it should be a multi-component interventions are required and multidisciplinary, interdisciplinary, team-based approach also is required. So having considering this need, so we have proposed and we are carrying out a research project currently, which is the ongoing research project. Part of that, I would like to share few of the preliminary outcomes. So the research project which we are carrying out in our school from our aging lab in the school. So we are doing a prevalence of risk factors and also developing a innovative multi-component cog-fix intervention to see its effect and impact on not only the functional and also the cognitive parameters. So in this, the first part of it, phase 1 is limited to the survey, that is cross-sectional, where we are assessing the physical assessment as well as gait and balance. We are also evaluating cognition and also the depression. Then later on, multi-cognitive, multi-component intervention is developed and implemented. We are in that stage already. So some of the preliminary outcomes. So having said that, the risk factors associated with the falls. So there are various types of risk factors we have identified already. This part of the survey is already completed. And based on our findings, I have segregated them into 4 important dimensions: health-related factors, individual behavior patterns, and also environmental and age-related or biological changes. So that you can see all those factors in front of you. We have adequately all those 4 dimensions are affecting the individuals for the risk of falls. Because of the limited time, I'm not going to elaborate all these factors what we have identified in our research. So I'll take you forward to some other also research findings. However, so when you see we have identified individual related behavioral problems, especially which are their lack of awareness, are not using the spectacles, are not using the assistive devices for the hearing or visual impairments, and also their behavioral factors, fear of falls, and also the environment, home environment, and also outside environment, and also biological changes and health related issues. So some of the preliminary outcomes I would like to say, when we had 344 of population, we have our survey, we have used both urban also rural population in our research. And here it shows that we have used from 60 to 85 years of age, and our participant minimum age is 65, and it is leading to 85. And we have that having that composition. Now I'd like to say the prevalence and predictors of falls, it is in, and there are more than 26% of the people have agreed that they had a one fall which also resulted moderate to severe injury. And many people, 71% above, said no fall because having a small injury and having some minor hit or such things are not considered as fall according to them, because only falling down on the ground is considered, perceived by the population as a fall. So having reported them, about 26%, 26.16% have had consequences of falls and fall related injuries also. And mobility is restricted due to the falls. You can see in front of you is sometimes or very often is 18%.
Dr. Varalakshmi, can you please wind up?
Yes. So here pain is also interfering their mobility, medications also interfering, and these are the health related issues which I was saying you that also interfering their mobility. And fall related injury, minor to moderate injury, you can see 43 to 48%. And because of the time constraint, I'll conclude that early identification of fall prevention intervention is very essential to preserve their quality of life and to reduce the disability burden, not just on the people, but also on the nation's healthcare system and also social system. And these are some of the calendars and some of the participants' glimpses during our project. And this is our lab where we are working on the gait training and cognitive assessment also. And I thank my participants especially, and also my institution, granting authority, my research team, and especially healthcare staff and team who are very supportive. And thank you for the opportunity by this organizing team. Thank you, because hope I do not want to take others' time, so I'm winding up. Thank you. Any questions? I'm ready to answer.
Thank you very much.